Alicia, would you be able to show me how to program the IV pump for an IV medication? At the clinical sites I was at, we had different pumps.
Yeah, I guess. Just give me a little bit. So, shouldn't you know how to do this already? Didn't they teach you anything in nursing school?
This pump is very different from the ones that I have worked with previously. The buttons are in different places and the settings are a little off.
Well, you're just gonna have to get used to them. First, I'd suggest you turn it on. Well, are you gonna help me? Or are you just gonna let me do it all by myself?
No, I'm sorry. I'm a little slow at this yet. I just need more practice.
I saw how Alicia treated you when you asked for help. I also saw how she continued to belittle you at the patient's bedside. That isn't fair to you or the patient, and you need to address Alicia to ensure that this doesn't happen again.
Yeah, it has been really hard to adjust to the working world since being out of nursing school. There are a lot of different pumps and different policies. I'm trying to learn as quickly as I can. When I ask Alicia for help, she has a tendency to get annoyed with me very quickly. I just don't know how to address her.
Well, make sure you address her privately unless you feel your safety is jeopardized. You can talk to her in the break room or at the nurse's station if no one is around. You can also use the cuss method, which is a way to say that you're concerned, uncomfortable, and your patient's safety is at risk.
Thank you for your help. I will use that method to address Alicia.
You should also speak with the nurse supervisor so she is aware of what has been occurring so it can be further prevented.
Thank you.
You wanted to talk to me?
Yeah, when I asked you for help in the patient's room, you seemed like you didn't want to help me. Then while we were at the patient's bedside paying the IV medication, I felt belittled for not knowing how to work with the pump. I felt concerned with the way you treated me and uncomfortable with how you chose to speak to me in front of the patient, and I feel that puts the patient's safety at risk when we aren't working together to complete a task.
I'm sorry, Andrea. I didn't realize I was being so harsh. The pumps really aren't easy to learn, and I understand that they can be very difficult. I do believe, though, that management needs to work on training the new nurses better on the IV pumps.
Do you think maybe you could teach me a few more things about the pumps tomorrow?
Sure. What about after our 11 o'clock assessment, we can go in and I'll show you a couple things on the pumps.
That would be perfect. I really do appreciate it.
Yeah.
Hey Andrea, how can I help you today?
Hi, I just wanted to let you know that I had asked Alicia for help today, and she seemed to be annoyed and unwilling to help me with the IV pump while in the patient's room. She made some unprofessional remarks such as, "You should know how to do this already. Did they not teach you anything in school?" And, "Well, are you going to help me or are you expecting me to just do it for you?" I asked to speak with her in the break room during lunch, and we talked about what happened and how her comments made me feel. After speaking to her, we seemed to have a good understanding of one another and how we will work together to best serve our patients.
Well, I'm glad you addressed Alicia. Confronting the situation right away is always the best option. But I'll make sure I make notes in each of your files and just make sure you keep lines of communication between you two open during this time.
Okay, I'm very relieved that we were able to handle this situation in a very simple manner. While I'm here, I do want to address the education that is being given to the nurses on programming the IV pumps. Alicia and I both agree that IV pump education needs to be improved so this type of situation does not occur between other nurses.
Well, thank you for bringing up your concerns. I'll look into the current education program we have in place for IV pumps and new nurses. And I'll probably be around asking staff for suggestions later this week. But I want you to have a great day. Know you did good confronting the situation, and just let me know if you have any other situations like this occur.
Okay, thank you.
Thank you.